I'm Philip Keiser. I'm the local health authority for Galveston County. We've recently implemented antibody testing throughout the county, and we've been getting a lot of questions about what antibodies are and how they work. So, what are antibodies and how do they work? Well, antibodies are molecules that the body makes in response to infections. These molecules then bind to the infection, in this case the COVID virus, and neutralize it and kill it so you can clear it from your body. So if you get tested for antibodies, what do the results mean? Well, first of all, you can have a positive test. That means that you've been exposed to the COVID virus at some point in the past. It can mean that you have an active infection, or it can mean that the infection has already passed and gone away. If the test is negative, that means you have not been exposed or not been infected with the COVID virus. So that leads to the question, if you test negative for antibodies, does that mean that you don't currently have or have never had the coronavirus? And the answer to that is almost certainly yes. There are a few people who are very early on in the incubation period who may not have developed antibodies yet, but we can detect 99% of the people who have not been exposed to the COVID virus using the antibody test. So the question is, does everybody who gets infected with COVID have antibodies? Well, 99% of the people who are infected with COVID will develop antibodies at some point. How long does it take for antibodies to develop? Well, it's different in different people, but for the most part, everybody that's infected will have antibodies detected within 7 days of their infection. So the big question is if you have antibodies, does that protect you from getting infected with COVID again? And we don't completely know the answer to that. We do know that after 3 months, most people who have antibodies are protected against reinfection. We don't know how long that's going to last, whether it'll be 6 months, a year, or even 3 months and 1 day. But we do know, at least for the short and intermediate term, it does provide protection. So how does the antibody test differ from the swab test? Well, first of all, the antibody test is a blood test, so it's much easier to get. In a swab test, we stick a small swab in the nose and get a sample. But more importantly, they tell us different things. The swab test tells us whether you actually have virus in your nose at the time the swab was done. That means you're actively infected, and more importantly, it means that you can infect other people. The antibody test tells us whether you've been exposed to the virus and whether your body has developed a reaction to it. So, how do we interpret these things? Well, for the most part, if anybody is asymptomatic and just wants to know whether they've been exposed to the virus, an antibody test will tell you very confidently that you don't have the virus if the test is negative. If the test is positive, you could either have an active infection or you could have recovered from that infection. So what we're asking people to do is, if they have a positive antibody test, to go ahead and get the swab. That way you'll know whether you have to isolate yourself, not go to work, stay away from friends and family, so that way that they don't get the virus as well. We're also asking that if you're symptomatic, that is, if you're feeling sick, if you have cough and fever, those cardinal symptoms of COVID, that you go right ahead and get the swab test, because in that case, you're much more likely to actually have the infection and to be infectious. And you also may be in that early window where some people don't have antibodies. So we would recommend swab test for active infections, or if you have a positive test, and an antibody test for everybody else who is curious about their status. So do people need to have multiple tests done over time? And the answer is yes, depending on the circumstances. If you feel sick, you should have a test. And if you had a negative test 3-4 weeks ago and you're feeling sick again, it's time to get another test. If you are worried that you've been exposed, you can have a test. If you're negative and then you have other exposures, well then you should consider having another test done. If you've been around someone who's been sick with COVID and you know they've had COVID, they have a positive test, well, you should get a test done, even if you've had a negative test in the past. But the only time you don't need to get a test done again is if you have positive antibodies. If your antibodies are positive, that tells us you've been exposed. We would then follow how you do clinically. I mean by that, we follow how your symptoms are going. And when your symptoms go away, you're no longer infectious, and then you don't have to worry about it anymore. And finally, the most important thing is that our best weapon against COVID is testing. So if you haven't been tested and you don't know your status, you should get a test. That's very important because then you can take the steps you need to keep your family and friends and loved ones from getting infected. We'd also encourage everyone to wear a mask. I know it's very controversial, but my mask protects you. Your mask protects me. We're in this together, and we all need to start acting like it. Thirdly, social distance. There's nothing wrong with going out and having a good time at a restaurant or some other place where you like to go. But be mindful. Look around. Are the people all crowded together? Is nobody wearing masks? That's probably not a good place for you to be. Go for places that are interested in protecting your health and protecting the health of their employees.